Hello and welcome to the Art of Being Human. The last segment we did a whole thing on PTSD, what it is, how you get it, what happens with it, and I decided that today I want to continue and do more work with PTSD. And the reason that I want to do it is that so many people have it. And the sad thing about PTSD is most people who have it don't necessarily know they have it. It's a case of they have symptoms, and the symptoms are very uncomfortable, and the symptoms can be immobilizing, and they can be fearful, they can be awful, but they don't view it as a syndrome. Most people don't view it as a syndrome of PTSD unless they're told they have it. If they're told, well, this is all part of a PTSD reaction, then they can handle it better. And I believe that a person goes to a counselor if they want it. Not everybody wants it, and you don't want to force it on anybody that doesn't want it, but I think that everyone who goes to a counselor who wants a diagnosis should have it. And I know some counselors will even take the DSM, which we use for diagnosis, and show them, look, they opened it to the page, and this is this, and these are the symptoms you have, and this is the diagnosis, and this is how it's coded, and this is what you're struggling with. And this is how we heal it. This is what we do to make it better for you. And if they can conceptualize this is a real emotional illness, and not because of anybody's fault, it's a condition that you have for certain circumstances that have happened to you, but if you can see it as a cluster of symptoms and it all fits in to this diagnosis, then we can tell them what the diagnosis is. And I think it's easier to handle. It's like if you know what you've got. A person may be depressed, a person may be anxious, a person may be fearful, a person may have problems with their memory, they may have some phobias, and they all may seem like disconnected symptoms. They're symptoms that they have, but they don't generally put them together on their own into one diagnosis. It's like supposing that you have a paralysis. Maybe you can't move your arm, or maybe you can't move your leg, or maybe you can't talk right. And you might think of those things as being all separate. Or you have a pain somewhere. What is this pain? Well, it affects this, that, and the other. But if you know what it is, and you know it's all connected with a diagnosis, then you know what you've got, and you know how to handle it better because you've got something. It's not a case of, well, I'm anxious just because I am, or I'm depressed just because I am. I can put these things together and we can make something of it. This is why I do this. This is why I do that. It just makes things so much more understandable. You know, PTSD was not really diagnosed until the 1970s. In the 1970s, we were embroiled in the war with Vietnam. And I know I was teaching college then. I had a college professorship in a southern university. And I know that a lot of students came in and they wanted to become students, and college students specifically, because if they were college students, then they could avoid the draft. They were afraid of being sent to Vietnam. And so they would avoid it by going to school. Now, I'm not making any moral judgments, you know, whether that was right or whether that was wrong, but that's what they did. So we had a lot of students. Now, a lot of people came back from Vietnam, and as I said last segment, when they came back, they were not the same as when they went over. They had all kinds of symptoms, emotional symptoms. They just weren't the same. A lot of anxiety, a lot of fear. And I told you what happened with my sister. Someone tried to break into her house, and I was on the phone with her, and she was terrified. And we got off the phone, and she called the police. It was a Vietnam veteran who was having a flashback, which was a part of his PTSD, which he didn't know he had. And he was trying to get into her house because he thought there were Viet Cong in there. And it's like he did a flip, a mental flip, and he re-experienced his Vietnam life, and he thought he was back in Vietnam once again fighting. And when that happened, you see, a lot of people could get hurt. He could hurt himself, he could hurt somebody else because of his emotional PTSD. Now, there are various phases of it. PTSD doesn't have to be so serious that you're not in your real mind, that you've lost contact with reality, but sometimes it can be that serious. So you may possibly, if you've had a lot of traumatic experiences, have PTSD and not even know it. And that's why I want to bring this to you again today, because I think it's a lot more common than what we think it is. For example, if you've ever been in combat, if you've ever had a serious accident, if you've seen somebody die a traumatic death, if you have been diagnosed with a life-threatening illness, if you have had a loss of somebody close to you, anything that's traumatic, anything that takes a toll on you mentally can cause you at some point to have PTSD. It doesn't always have to be combat experiences, although we found out in the 70s when soldiers were coming back, they were having a lot of emotional problems, and they got kind of ignored and finally diagnosed as post-traumatic stress disorder. But you can have it for various reasons. So let me go through this chart. These are the things that will give you post-traumatic stress disorder. Any trauma or abuse, either experienced or seen. You can see trauma, you can see abuse and have PTSD as a result of it, or you can experience it and have PTSD as a result of it. So it either has to be trauma that has been seen or trauma that has been experienced. Either one, you see, can cause it. You don't have to be abused to get it, because you can see somebody else be abused and get it. It's your own intense reaction. Anyone who reacts emotionally to things in an intense way, if you have a personality that's an intense kind of personality, you can do it. You are more prone to it than if you are not so intense, because it's harder for you to just kind of flow, or just go with the flow. It's harder for you to roll with the punches if you are a very intense person. So let's just take a look at this. Trauma and abuse, experienced or seen, and I'm going to focus on that. You can experience it or you can see it. Either one can cause you difficulty. Combat, rape will do it. Assault will do it. If you've seen a death, if you have experienced abuse or seen abuse, if you are diagnosed with a life-threatening illness, if you have a chronic illness, I want to mention this. What is chronic? A chronic illness is an illness that's not going to go away. It's going to flare up every so often. Diabetes, and I'm diabetic myself, it's a chronic illness. Multiple sclerosis, any of those nerve kind of things that stay with you, MS, a lot of those nerve kinds of things that just stay with you, you never quite get rid of it. Now, I do believe God heals, and I know that God can heal, but if He doesn't, you're going to have these illnesses for the rest of your life. For diabetes, it takes about 6 weeks to adjust to the fact that you even have it, because it's hard to imagine something being wrong inside of you that you can't really feel and you can't really see. It's not like having a broken leg, where, I have a broken leg, I have to get myself in a cast, I have to go to the doctor, they cast it. And then when it's over and it's healed, you're out of the cast and you're fine again. You may have to have some therapy, but it's not long lasting in the sense that you're going to have it for the rest of your life. Any chronic illness is one that keeps repeating itself, that flares up every so often. Lupus would be one. I mean, it can be anything, but that's what chronic means. A chronic illness, having been in a bad accident, being involved with a dysfunctional family is one that does not behave itself. It does not function like a normal family. Most families, if they're a good family, you'll have support. You will love your parents, you will love your siblings, and they will love you back, and you get along with each other, and you care for each other, and you don't know what you'd do if you didn't have each other. It's just a free-flowing kind of a nice situation. This is the kind of family we like to see. This is the kind of family we want children to be born into and grow up in. But if you have abuse or drugs or alcoholism, those are the three big ones. I ought to put in here chronic illnesses, because if you have somebody that has an illness, a severe illness, and the whole family has to adjust to the illness, then that can become a family that's dysfunctional. If you have severe pain, and it's unremitting pain, and you can't get rid of the pain, and it's always going to be there, or for a long period of time. I've met a lot of people who have back problems, severe back problems, and when they get treated for the back problem, they can be out of it for months. They can have pain for months. They sometimes have to wear a special TENS unit to see if they can stop the pain that way, or they're going to a doctor for months on end for treatment, or no matter what they do, they're limited in terms of what they do because they're going to get more pain out of it, and their lives revolve around avoidance of pain. That's also a part of it, can become a part of a PTSD reaction. Loss, any kind of a loss, through death usually, but you know, loss involves more than death. It involves, say, loss of a job, or moving, or losing a friend, or having a friend move away. And it's traumatic if you're close. When you have a separation, whenever you have a separation, you have grief. And we are going to go into special segments in terms of handling grief, handling depression, and I'll also be doing special segments on suicide, how to handle suicide, how to prevent it, how to prevent yourself if you tend to think about suicide, how to stop that, what kind of help you can get, where you can go for emergencies, and so forth. We will be getting all into that later. Right now we're still getting involved with relationships and what messes them up. But loss, natural disaster, think of how bad it is in the South when the tsunamis hit, or in Japan, you know, when they had the problems that they had. And they lost their reactors, and they had floods and all of that. So any of those traumatic big things that hurt you, that threaten your life, anything that threatens your life, threatens your well-being, makes you fear that when you get up in the morning, you don't know what's going to happen next. Anything that threatens you in any way and threatens your peace of mind, all of those things can cause PTSD. And so that's a whole long list, and a lot of people have PTSD. Okay, whoops, I'm just going to put that down. It causes a lot of anxiety, and I guess I have shown you charts of anxiety before, but I want to go into it from the point of view of having PTSD. There are different types of anxiety. One thing I have not discussed yet is obsessive compulsive behavior. That can be a part of a PTSD. And one thing I have not also done is to discuss dissociative reactions, and if I get a chance, I'm going to do that next session. What is a dissociative reaction? How do you phase out? How do you split off? You know, some people have dissociative disorders. So generalized anxiety disorder, sometimes GAD, abbreviated GAD, generalized anxiety disorder. You will have a lot of that if you have PTSD. It can be chronic, and here again that word chronic, it keeps coming. It's a very high anxiety, but it's not necessarily tied to any immediate event. That is, a person can feel so afraid, so frightened, and you can't connect it with anything that's going on in their life at the present time. And what they're really doing is they're reacting to things that happened to them in the past. If you think that when you get finished with something in your past, that it's all over with, if it's not handled right, it keeps coming back to bother you. And it will bother you, and it takes on a life of its own, so you're reliving your past pain, but it can be very, very, very intense, very frightening, very chronic in the fact that it just keeps coming back. Phobic disorders, it's an irrational fear of some object or a situation, and presents no danger. You know, I may see a dog on the street and be terribly afraid because years ago I was bitten by a dog, but this particular dog is on a leash and presents no danger, but I'm just as afraid as if it did present danger. So phobic disorders tend to be irrational. You have to understand why you have them, and we've gone into before complex and simple phobias. Panic disorders, it's overwhelming anxiety, and it comes on suddenly and it comes on unexpectedly. You can be in the middle of a store and suddenly you feel so anxious and disturbed that you just want to scream and you don't know why. Panic disorder, very, very hard to deal with. Obsessive compulsive, we have not gone into it, but we will. Obsessive compulsive is when you have a lot of uncontrolled thoughts and you have a lot of compulsive behavior to control those unasked for thoughts. Now, you may not be aware so much of the thoughts, that may be somewhat unconscious, but you can get flooded, and that's the term for it, flooding, with thoughts, irrational thoughts, and they frighten you, and you have to control them, and the idea is to control them, and you do that by doing certain physical things. One obvious example is hand washing. Some people wash their hands every 2 or 3 minutes. They're afraid of something, something bothers them. They have thoughts that come into their mind. The thoughts themselves bother them. They may not even be fully aware of what the thoughts are, and as a result of that, they try to get control of those thoughts. That thoughts would have to go away, and they do that by doing certain things, and some of the things that they do can be bizarre. I mentioned hand washing because that's an obvious one, but they can do other things. People who count to 10 every time they see something, people who count to 40 every time they put their foot over a crack in the sidewalk. You know, it gets to be a little bit off the wall. It can be difficult because, I mean, it's not going to make a person insane or anything, but it's going to be difficult because their lives are taken up by doing things to control other things, and so they waste a lot of their lives, and it's very troubling. I've seen people who spend all their life counting. Well, I've got to count to 15 now because of this happened. I got to count to 25 because that happened. And it's really too bad because it becomes immobilizing after a while. This is a part of obsessive compulsive behavior. You have the unwanted thoughts, the disordered thoughts, and you have rituals like the hand washing or counting to stop it. It doesn't work, of course, because you have to keep doing it over and over and over again. And then you have the post-traumatic stress disorder, which we are now discussing. Well, I think I better close it here. We've got a lot more to do with this, and so we'll continue with this next time. And this gives you a sense of what it is. If you have a conglomeration of symptoms, it may be that they're all lumped in with this one diagnosis. It's important for you to know that because you need to know that to help you heal. So I hope you learned something, and please join me next time as we continue with this.